Dr. Durrani, thank you so much for being here with us. You work in Houston, as I mentioned, and you say a few of your close friends actually attended the festival. What did they see?
Yeah, they did. It's such an unfortunate event. I had personally attended back in 2019 and had close friends that attended this past year. In my discussions with them over the last 24 hours, there's a few things that they mentioned. There were those viral clips of, people pushing down those security barriers earlier on in the day. They had seen that even when they were entering, that there were a few people kind of trying to climb over fences and whatnot. They themselves were located about halfway kind of into the crowd during that Travis Scott concert. And they said that, in the first 20 minutes or so, they were essentially pushed backwards. There were numerous people that in that initial 20 minutes fell to the ground and were stepped over, and they all were separated for a good 20 minutes or so. At that time, they actually contemplated leaving. They ended up staying and standing way towards the back, kind of away from the crowds. And throughout that time, they noted ambulances and whatnot. But it seems like even towards the beginning of the show, there was, some unrest and kind of these crowd surges happening.
Yeah, and Doctor, you were actually asked to be on the medical staff for Astroworld, this festival there in Houston, but you actually couldn't make it due to other obligations. There are reports this morning that I want to ask you about that the medics there were poorly trained and quickly became overwhelmed by the situation. What are you hearing, and how are these medics actually trained to handle a mass casualty incident like this?
Yeah, I'd say for a mass casualty event, I don't think you could ever truly be prepared. What happens is no matter how many resources you have, those quickly become overwhelmed, whether that's personnel, whether that's a medication like Narcan, whether that's other equipment. And so when that happens, you have to go into triage mode. And that essentially means, going back to our ABCs is what our training is: airway, breathing, circulation, assessing as many patients as possible to make sure that they're breathing, that their airway is open, that their heart is pumping and their circulation is good. And that's really hard to do. And, even in the emergency department, then you go into a dark environment. It's loud. There's a lot of noise. There's no light. And there's numerous fatalities, as we now know. And so that makes it really difficult. And so I can't speak to the training of these particular individuals or anything like that. But that is just a very difficult setting to practice in and to save lives.
Yeah, I'm told there were teenagers who were performing CPR on other teenagers there at the concert. Based on some of the footage that you've seen, does it appear as if this was a stampede incident that took place with many of these kids? You have these reports that somebody or maybe some others were injected by a syringe. What do you make of what you've seen and heard?
Yeah, it seems like it was probably a combination of a few different things. We obviously know that there was CPR being performed, which means that there was cardiac arrest. And so when you have a stampede type situation or crowd surges, essentially you're being pushed from all directions. You're not able to expand your lungs and get oxygen, and that's going to lead to you passing out, and not getting oxygen to your heart is going to lead to cardiac arrest. In addition to that, being trampled over or pushed is going to lead to traumatic injuries. That can lead to, things like internal bleeding. And once you have a lot of bleeding, you're not going to get blood to your heart, your brain, and your heart will stop, and that'll happen. And then, of course, there are these reports of fentanyl, which is an opioid medication 80 to 100 times more potent than morphine. And so what an opioid does is essentially, depresses your cardiorespiratory system. Your breathing slows down and eventually stops, and your heart does that. And so that can lead to cardiac arrest. So it could be all of the above, one of them, or a combination of those things.
Very interesting. Well, there has been an issue with fentanyl all across the country lately, with a lot of people dying from it. Hopefully that was not the case with this particular incident. Dr. Durrani, thank you so much for your time. Appreciate it.